From being a Harvard graduate to an Emmy Award-winning writer for Saturday Night Live to one of Washington's strongest supporters of those with mental illness, Minnesota Senator Al Franken. That's who, and he's joining me for a conversation next on Speak Your Mind. Welcome to Speak Your Mind. I'm Dr. Carolyn Phelps, licensed psychologist with the Human Development Center. 25% of us will develop a diagnosable mental health problem over the course of our lifetime. And if you've watched Speak Your Mind, you've heard me say that over and over again. But only a fraction will get the help they need and deserve, help that can transform or even save a life. But why are only a fraction of those who need help getting help? Well, there are many barriers people face in accessing mental health care. Stigma, as we know, certainly is one, and Speak Your Mind is a show that works hard to decrease the stigma associated with mental illness. But it's not the only barrier that we have, so we need champions out there to help reduce barriers to accessing mental health care. And I have one of those champions sitting right next to me. Minnesota Senator Al Franken has worked tirelessly to understand the problems associated with accessing mental health care and then worked tirelessly to solve some of our access problems by writing and helping to pass legislation that benefits all Americans. He graciously agreed to sit down with me and talk about his work and a little about himself. But we're actually here on a Saturday afternoon, so don't be calling in questions because for you it's Thursday night and WDSE hasn't quite figured out that whole time-space continuum warping thing yet. Senator Franken, thank you so much for being willing to come here.
I'm glad you haven't figured out the time-space continuum thing. I like it the way it is.
The way it is, because your schedule is busy enough as it is,
yes,
right?
Yes.
I think the first question I have for you really is about why the interest in mental health, because not all of your colleagues on Capitol Hill share not just your interest in mental health, but really your commitment and your devotion to this. Well,
one real key reason is that this was the seat that Paul Wellstone held, and Paul was a friend of mine, and he was such a leader on mental health, and of course he did the mental health and addiction treatment parity bill with Senator Pete Domenici, Republican of New Mexico. When I got to the Senate finally in 2009, the regulations on that bill had not been finished in Health and Human Services, so I put a lot of focus on that. And and if you go around the state and talk to people and ask about it, you find out that there's not enough access to mental health services. Just as you said in your opening, there's a problem with stigma. There is one of the things I've worked on is mental health in schools, so that we diagnose people early and get them treatment early, and that can really, you're right, it does change lives. And then there's been, we're just coming off of another series of shootings that has raised the issue of mental health, and I am concerned about. I'm glad there's a focus on it, a renewed focus on it, but I worry about the stigma, because the people who do those shootings are, deranged. They're paranoid schizophrenics, but that's a very, very, very small part of who is mentally ill. And we do know that people who are even severely mentally ill are much less violent when they're in treatment. And so this is a big subject, and And it's one that I've tried to tackle as best I could.
And in fact, I just need to feel like I need to comment on part of what you last said, which is people with a serious mental illness are much more likely to be victims of violent crimes than they are to be perpetrators of violent crimes. And
in the I'm sorry, but in the after Sandy Hook, there, I'm on the Judiciary Committee, and we were talking about guns there, about assault weapons ban, those kind of things. I would start off by saying that every time, that people with mental illness are more often the victims of violence than other people.
Absolutely, and I think that it is an opportunity for us to raise awareness for mental health, and yet we always want to be clear that we're not blaming people with mental illness for every tragedy that's coming down the pike, or that's just occurred or that's going to occur next week, as the frequency seems to be increasing with these kinds of tragedies.
Yeah, and if anything, what we can do is we can do smart things to prevent people from going without treatment, and we can diagnose people earlier and change lives around. And the mental health in schools piece is something where you see entire families, and this is the case, of course, with mental illness, is that it affects everybody in the family. And so this is an area that I've paid a lot of attention to.
So let's go back and talk first about the Mental Health Parity Act, which is, you said, was an unfinished bill at the time when you came in. And first, just explain for our viewing audience what that bill was intended to do.
Well, it was intended to say treat behavioral health the same way you do as physical health. And that also has a lot to do with about stigma, which is that this, mental health is a disease just like diabetes is.
Absolutely.
And so what Paul Wellstone and Pete Domenici were doing in the Senate, and actually Jim Ramstad and Patrick Kennedy in the House, was basically saying that insurance companies who carry coverage for behavioral health should treat it on parity with physical health.
Because a lot of insurance carriers weren't offering plans where they would insure people for mental illness, and a lot of employers weren't doing that either.
Yeah, actually their bill said that if you are carrying behavioral health, you have to do it at the same level. It didn't speak to requiring behavioral health. Now, in the Affordable Care Act, every policy that's on the exchanges does have to carry behavioral health.
And that's one of the I think the best one of the best I think there are a lot of good contributions for the Affordable Care Act, but making that mandatory for those who are through the exchange has just been wonderful, because a lot, we see a lot of people and they come in, and we're even in my organization will see if you have no insurance, but it is the underinsured who are really standing to suffer. The Affordable Care Act kind of bridges some of that gap for those who are on the exchange.
Sure. And I mean, obviously, I think the biggest achievement is how many more millions of people are covered now, and reducing the number of Americans that are not covered. And then there has been a lot of reform of the delivery of health care that's been beneficial in keeping down the growth in the cost and bending the cost curve, as we said before we passed it. And so there's been a lot of contributions, but one of them, of course, is having that requirement in policies that are on the exchange.
And also, so viewing audience, so that you understand how this works, we don't have a system anymore where insurance carriers can treat physical health conditions different from mental health conditions, and one of the reasons is because of the fine work that you've done with that, and that's huge. That's really huge. So
well, we're not totally there yet. I mean, we're certainly not there yet. And I'm co-chairman of the Rural Health Caucus in the Senate, and I've done a lot of roundtables going around the state about rural health, and something that is uniform around the state. I'm sure it's uniform around the state, even in urban areas, but in rural areas, the lack of mental health providers and the lack of beds, and so that even people who are identified as needing treatment can't always get treatment in a timely way, and that's a real problem. And we need more mental health providers, and we need to make it more accessible.
And one of the ways that I know that we're working to make mental health care accessible in rural areas is also through telemedicine.
Yep.
And the research on telemedicine is that, there's a lot of resistance both in terms of patients' perceptions and in providers' perceptions. But if you take a look at the research that's been done, the research for mental health care delivered through telemedicine is that good care outcomes are as possible and as achievable through telemedicine as they are through face-to-face. And I think this really stands to be a great solution, or at least part of a solution, for very rural areas who don't have access to the number of providers that they simply need.
It's better to have a doctor who's seeing you through telemedicine than one who's not seeing you.
Than one who's not seeing you at all.
And for stroke victims, it's a big deal. I mean, it's not about mental health, but there are decisions you have to make in a stroke within a couple of hours, and it's better to have a doctor there. And this is one reason we need rural broadband.
And that is one of the biggest barriers, that you have to have good connections, good internet connections to be able to.
So that's another issue I've been very involved in. Is you have to have high-speed internet in today's in 2015, and for everything, for business and for
and I think that just
life.
I think that just sort of really underlines the complexity of the problem of accessing care. Let's go on to talk about mental health in the schools and
Sure.
what the Mental Health in the Schools Act has done for us.
Well, after the Sandy Hook shootings, I heard a lot of other of my colleagues say, well, it's not enough to talk about guns, and they're right. You have to talk about the culture and mental health, but then that was it. And I kind of felt that they had checked off a box talking about mental health, and I know my colleagues who have actually invested some time and effort in this area. So I went to actually Sue Abderholden, who's head of NAMI here in Minnesota, the National Alliance
on mental illness.
On mental illness. She said mental health in schools. So I went to Irondale High School in the Mounds View School District and heard from some parents and counselors and teachers and the principal and superintendent what they did there. And what they did there was they trained every adult in the school, from the bus drivers to the principal to the teachers to the lunch ladies, just what it looked like when a kid might have a serious mental health issue. And that adult would tell the school counselor or psychologist or social worker, please see this child. And if that professional decided that the child had indeed probably had some kind of mental health issue, get them access to community mental health services. And I talked to a number of moms who said that what enormous difference this had made for not only their kids but for their entire family. And one mom who had a 9-year-old son, a 3-year-old daughter, single mom, and her 9-year-old was kind of out of control. I think he was 8 at the time, and but they got him a mental health advocate, and ended up diagnosing him as having ADHD and Asperger's, which is on the autism spectrum. And they treated him, and they turned him around, and he was doing well in school and taking Taekwondo, And the mom looked me in the eye and said, I am now bulletproof. I can do anything. And I just said, let's do that. Let's do this. So I took that to DC and we wrote up actually an amendment to the gun bill. And it had some other things in it too, but this got 96 votes. While everything else was very contentious, there was wide agreement on this. The bill didn't go anywhere, but I got funding for this from the appropriators who saw the wisdom of this and got some significant funding for it. And now in the latest K through 12 education bill in the Senate, we have more funding for that, and that now we got to get that. We got to do a conference with the House and get that voted on both houses and signed by the president, and then we'll do that. But this is, I've gone to schools that use this, and they are very happy about this new funding.
So in the state of Minnesota, what we've done with that funding is a combination of training people, like you said, training adults who are in the presence of children to recognize when there may be an emotional or behavioral problem, where there's at least, let's lay some eyes on you and see if we need to take this a step further. The state of Minnesota, with this mental health in the schools, has also funded training for therapists, for mental health care providers, in doing good quality evidence-based treatment for people who have mental health problems, and have also, and this has been around for a few years now, have a system whereby mental health professionals are co-located in schools.
Which is great.
Yep.
Because that means a parent doesn't have to take the kid out of school to see a therapist. So yeah, and also it reduces the stigma, because I've been to schools where they say that the kids high five their therapist, in the hallway, and I think that's a very healthy thing. And also it takes the burden off teachers. Teachers aren't mental health professionals.
And that's not their job.
That's not their job. Their job is to teach, and if you have a therapist in the school, it's a very good model.
I think that where we see the most success are in two places. One, in some of our very rural areas where it's very difficult. Kids sometimes come from very challenging backgrounds. These are kids who, if they weren't being seen in the schools, their parents probably wouldn't be getting, or their care providers may not be getting them to the clinics. And so now, it's like, well, where do kids go? They go to school. We kind of have an audience there. A drawback is, it is a drawback if parents are not involved in care, because kids don't, we try not to just treat kids, because kids live in families. We really want to treat, to be able to treat.
Well, I had the sense in this that, in the example I talked about, that the mom, the boy had a mental health advocate, and the mother said that mental health advocate had become someone she talks to almost every day.
Yeah, and that in the best case scenarios, that's the way it should be.
Yeah.
Right?
Yeah.
That's the way it should be, is interested parents who just need some help in accessing the resources.
But what this means is that, in many of these cases that we've seen with violence, if people are identified and treated early, it doesn't get to that. And and again, it needs to always be said that we don't, mentally ill people are not more violent than.
Well, I think a different way of saying what you're saying is, let me help you out a little bit here, Senator Franken, is that what do we know about any kind of health problem? If you treat it earlier, you have a smaller problem than if you wait to treat it down the line. So you can stop smoking cigarettes before you get COPD, before you get emphysema. But if you get, once you have emphysema, you kind of have emphysema. That's not going away. You can still stop smoking, but that's not going away.
Right.
We want to do the same thing with mental health problems, which is we want to treat them when they're smaller critters and more easily treatable. And so that you don't have a system where kids are trying to learn under conditions that are impossible. If your internal house is on fire, fractions is not going to be your number one priority, probably.
Yeah, and we know that kids who that experience trauma and things like that also, that affects your brain chemistry.
Absolutely.
And so
and your ability to learn.
And therefore your ability to learn. And we know that in many cases, sort of non-cognitive abilities are as predictive of success in school as cognitive abilities. So you want to make sure that a kid's house isn't on fire.
Yeah, absolutely. We're getting short on time here.
Really?
Yeah, we are.
Okay, we didn't go to
justice,
mental health and justice.
That's what we're going there now. Justice but we're going to have to talk fast. So,
okay.
Justice and Mental Health Collaboration Act. We were at a roundtable together earlier this spring.
We had way
March.
too many people in prison, and we have way too many people in prison who are in prison because of mental illness. And so
and prisons aren't treatment centers.
They're not treatment centers, although they're the largest housing of mentally ill people in the country. So I have a bill that's bipartisan, bicameral, meaning both the House and the Senate, that would create more mental health courts. So if the prosecutor and the arresting officer, et cetera, and the defense attorney say this person really doesn't belong in prison, they belong in a mental health court, and diversion to treatment rather than prison, because there's so many people who go to prison and get worse, then they get released, and they get into a cycle that just is a downward cycle, and unless people have proper treatment, they get worse and worse, and it doesn't help anybody.
And we know that in some instances where mental health problems are what is creating the criminal recidivism, if you're not treating the mental health problem, why do you think the criminality is going to stop? But if you can get the person the resources that they need, the treatment, the housing, income, whether
the wraparound services. Yes.
You have the ability to change lives and make communities safer, and it's cheaper for the community. I always say to people, if you don't like it on the moral grounds, you should at least like it on the financial grounds.
Yeah, the overcrowding is incredibly expensive. Prison's most expensive place to house people, and this does save. Studies show that this saves a tremendous amount of resources.
And one of the ways that the current bill was expanded was also to include services for veterans and veterans courts as well.
And we haven't, this should pass easily, and we just got to get it taken up in both the Senate and the House.
So is that next on your list then?
It's one of the things on it's one of my urgent agendas, yeah.
Excellent. We are running out of time.
Okay.
I so appreciate your coming here.
My pleasure. Thanks for having me on.
Yeah, you're taking time out of your Saturday, and you were so gracious to do that and come here and talk about, and for us to really have the opportunity to highlight the fine work that you do, because the work that we have to do in our community around mental health is not just at the personal or the community level, but really also at the national level. We are one big, huge family here, this melting pot that we are. Now, Senator Franken's doing his job in writing legislation and helping to get legislation passed to make access easier for all of us. But that means that you need to do your job too, which is if you know somebody who has mental health problems who could benefit from mental health care, or if you yourself could benefit from mental health care, please pick up the phone and call somebody. Do that for yourself, because You deserve to not be suffering anymore. Thanks so much for joining us this week. We loved having you, and don't forget to visit us on the web at speakyourmindonline.org, where you can find a schedule of our topics and resource links and read my blog. Join us again next time when we'll return to our call-in format. I'm Dr. Carolyn Phelps. Thanks for watching, and good night.